Welcome to Healthcare Without Networks, a complete overview of Medicare supplements. I'm Clifton Stubbs. So what are those guaranteed issue periods? Now this is probably the most important point of this whole presentation because out of all the questions that I get from brokers, it's usually over guaranteed issue periods. So there are several, and we'll start off with the very first one, which is the initial enrollment period. When a senior turns 65 and enrolls in Part B, they have a guaranteed issue period for 6 months. Now this is important because it takes two triggering events. They have to turn 65 and enroll in Part B. If they don't enroll in Part B, maybe because they are still working, their 6-month window does not start until they actually enroll in Part B later down the road. Next is pre-65 eligibility. People can qualify for Medicare prior to turning 65 due to a disability or end-stage renal disease. Now, in 27 states across the country, they are guaranteed to get at least a Plan A. In those states, though, they still have a guaranteed issue period of 6 months from their Part B effective date. Now, the key is they need to enroll in that 6 months because after that 6 months passes, they can still, with most plans, get on a Medicare supplement Plan A, but they will have to go through underwriting. And in a lot of scenarios, if they are permanently disabled, there's a good shot, depending on what that disability is, they will not be able to answer all of the health questions. When they do turn 65, whether they live in one of those 27 states or not, they will still receive their initial election period when they do have their 65th birthday, and they will be able to go on any plan that's available in their state without having to answer the health questions. Additionally, there are state mandated open enrollment periods. For example, California has the birthday rule. So every year on their birthday, they have 30 days after it to change Medicare supplement plans, regardless of carrier, to an equal or lesser plan without having to answer health questions. Now, that doesn't give them guaranteed issue to get on one if they are just on original Medicare or coming off of a different plan. But if they currently have a Medicare supplement, they could change to an equal or lesser plan. Other guaranteed issue periods include loss of group coverage. Now, this one has two different guidelines to go by. If you have a client who has not enrolled in Part B and is still working, typically they're going to be working for a company that has 20 more employees and never enrolled in Part B. They get 6 months from their Part B effective date. And so if they coordinate that from the time that their employment is going to end and their benefits are going to end, they'll have 6 months of guaranteed issue. Now, if they join Part B when they first turned 65, just because they felt like they had to, or because they were working for a company that had 19 or less employees where Medicare was primary, then they only have 63 days from when their coverage ends in order to get guaranteed issue. Additionally, they only have 63 days from the time that their COBRA ends in order to get guaranteed issue if they have already signed up for Part B. Now, the key is you want them to make a decision right away, because if they're getting a Medicare supplement, they're going to also need to get a Part D drug plan, and the Part D drug plan only gives them a special election period for 63 days. So you want to get them covered and on their way. You don't want them to wait out the 6 months. Additionally, plan termination gives them a special election period. If they're on any type of plan and it cancels, the carrier goes out of business, they're moving out of state, they don't renew their plan the next year on a Medicare Advantage plan, they have 63 days from the time the coverage end date to get on a Medicare supplement plan guaranteed issue. Additionally, changes in service area. We talked about how Medicare Advantage plans and Medicare Select plans have a defined service area. If the client moves out of one of those service areas, they get a special election period for guaranteed issue, and that is 60 days prior to the coverage end date, as well as 63 days after the coverage end date in order to get on a Medicare supplement. Lastly, there is a trial special election period for Medicare Advantage and Medicare Select plans. It must be the first time they've been on one of these plans, and they must change within the first 12 months. So if they turn 65 and they immediately got on a Medicare Advantage plan, during the first 12 months, they could go back to a Medicare supplement plan, guaranteed issue. If they had been on Medicare, they were on a Medicare supplement plan, and they switched to try out a Medicare Advantage plan, within 12 months, if they didn't like it, they have guaranteed issue to go back to the carrier and plan that they had previously, as long as they are still doing business in the state. If for some reason they are not, they can go to a different carrier and still have guaranteed issue rights. Now that we have the basics and the rules out of the way, let's take a look at rates. Now there are three major ways that carriers determine their rates. The first one is attained age. Now that we've gotten through basics and rules, let's talk about rates. There are three major ways that carriers propose their rates. The first one, attained age, is by far the most popular. The premium is based on the client's current age. And so every year on their birthday, they're going to get a nice little letter from the insurance company saying happy birthday and letting them know that their rate is going to go up. And it's only going up incrementally by a few dollars a month, typically. Now, in addition to that, the premiums may increase for inflation and other factors such as rate of claims. So it is possible that you could get 2 rate increases within a year. Now that's actually after the first year of policy, because most carriers have a 12-month rate guarantee. However, you could get a rate increase on your birthday if it was in January, and if the carrier raised their rates in May, you would still have to pay that rate increase when it came about. Now that we've gotten through basics and rules, let's take a look at rates. Now there are three major ways that carriers rate their product. The first one, attained age, is by far the most popular. The premium is always based on the current age of the client, and the premium is going to increase every year on their birthday. Now, the carrier may increase for inflation or other factors, and I'm here to tell you that they probably will. Every year there's going to be a rate increase, and every carrier kind of has a set month of where they do that. And so it is possible after the first 12 months of the policy that your client could get 2 rate increases in 1 year. For example, if their birthday was in January and they turned 66, they would get a slight rate increase. And then if the carrier took a overall rate increase due to inflation or other factors in the month of May, they would also receive that rate increase. Now, the second way to do that is by issue age. This is certainly not the most prevalent way, but there are certain carriers that still rate their products this way. Issue age means that the premium is based on the age when the policy is issued, kind of like a life policy or maybe a long-term care policy. But don't let that fool you, because they're going to get premium increases for inflation and other factors just like everybody else does. Now, you will hear companies who promote issue age products to say that they're much better off because that way your client will never get 2 rate increases in 1 year. And although that may be true that they will not get 2 rate increases in 1 year, I'm here to tell you that whether it's attained age or issue age, what really matters in the end is how that carrier manages their book of business. If they manage it well, the overall increase over a period of time will be low. If they don't, they will see double-digit increases year after year. Finally, the last way that carriers rate products are the ones who do community ratings. Now, typically, you would find this in a guaranteed issue situation. AARP used to rate their products this way, but they have gone away from it. But basically, in a community rated product, the premium is the same regardless of age. So it doesn't matter whether you're 65 or you're 90, you're going to be paying the same rate as somebody that's in that same defined community. And a community can be defined by a block of zip codes, by a county or a block of counties, or by an entire state. And again, those premiums are going to increase for inflation and other factors. Typically, when you have a carrier that does that, it can be very easy to sell because if you're 65, you're paying way too much. And if you're 90, you're getting a great deal. Now, there are other factors that go into determining the actual rates that they put on the paper. There are discounts for pretty much everything, including if you do an EFT, you can get a discount. If you have somebody else in your household that has the same carrier and the same supplement plan, you can get a discount for that. The carrier may not be able to rate your policy up due to underwriting, but if you are in perfect health, you may receive a discount for being healthy. You may also receive a discount off of the rate for signing up for a Medicare supplement right when you turn 65. In addition to that, if you have a Medicare Select plan, obviously you're agreeing to use a network hospital, which keeps their costs down. They pass some of the savings on to you, as well as a high deductible plan. If you're willing to take the first $2,000 of risk, obviously you will see premiums very low. Some of these plans, depending on what state you're in, a high deductible Plan F can be as low as $40 to $50. That brings us to carrier partners. BenefitMall prides itself on offering an array of carriers that you can offer your client that are top-notch and mostly A-rated in every state that we do business in. As you can see, we have an entire list of carriers. That list will change and it will probably grow because the sun doesn't shine on the same insurance company year after year. But we can get you appointed and ready to sell with any one of these carriers with a simple phone call. And finally, as I promised before, I'll leave you with a list of resources. There's only so much that we can put into a presentation, and I know that questions will come up after you end this presentation. The first resource available to you is always Medicare. Now, there's the toll-free number for people to call, but I highly recommend that if you have access to the internet, that you utilize Medicare.gov. Not only can you find a more consistent answer, you won't have to wait on hold for 20 to 30 minutes, but you can also find publications and you can see the frequently asked questions, and that will probably expedite the answer that you're looking for. In addition to that, there's a state health insurance counseling and assistance program that's available in every state. There are going to be times where you run into clients that need more help than you as an agent can give them. It could be for assistance, it could be in filing a grievance or a complaint, or just understanding of all the different programs that are available to them outside of private insurance. Feel free to send your folks to that program. Additionally, if you want to see if there are rules that apply to you that are state specific, you can always go to your state insurance department website. For example, the California rule, or if you want to see how the rules differ for voluntary or involuntarily leaving your group coverage, they're all right there at your state insurance department website. But the number one resource that you should always go to, and this is why you're here, is BenefitMall. We have an entire team of experts that are here and waiting to help you and to answer your questions. And if we don't have the answer to them, certainly we will find the answer for you so that you don't have to. There's a toll-free number. It should be programmed into your speed dial. Also, make sure you get registered for BenefitMall.com. And BenefitMall.com is a wealth of knowledge about what we offer here at BenefitMall. You can also get carrier information. You can get quoting assistance. You can log into your broker workspace to track your cases. You can also find out just from the very front homepage what events are coming up in your area or future trainings. So it's a great resource and everybody should utilize it. That concludes our presentation. Thank you for taking time out of your day to view this. If you have